Today we are going to talk about fibromyalgia, a chronic pain syndrome that affects millions of people. Fibromyalgia is characterized by chronic fatigue, widespread muscle aching, stiffness, sleep disturbances, and functional impairment. In the United States, it is estimated to affect over 5 million people, or about 2 to 5% of the population. Women are more frequently affected than men, and between a quarter and 2/3 of patients also have another rheumatic condition, such as rheumatoid arthritis, lupus, or ankylosing spondylitis. The underlying mechanism of fibromyalgia is thought to be neurogenic in origin, meaning the central nervous system plays the key role. Normally, our nervous system has ascending and descending pathways that regulate pain processing, acting like a built-in volume control. In fibromyalgia, this system malfunctions and the pain volume is turned up too high. That means stimuli that shouldn't cause pain, like light touch, can actually feel painful. This amplification of pain often develops in the setting of predisposing factors such as anxiety, depression, physical or emotional trauma, viral infections, or chronic sleep problems. Diagnosing fibromyalgia can be difficult because it is a diffuse syndrome. Standard blood work and imaging tests are generally not helpful, except to rule out other causes of the pain. One helpful screening tool involves applying pressure to the Achilles tendon. If pain is triggered, that can be a clue. Another clue is when a patient reports a persistent, deep aching all over the body. A positive response to either of these should be followed by a comprehensive exam before confirming the diagnosis. Treatment focuses on managing the symptoms most troubling to the patient. NSAIDs may be used to relieve diffuse muscle pain and stiffness, although their benefit can be limited. Restoring sleep is a critical piece of treatment. Low-dose tricyclic antidepressants, such as amitriptyline or nortriptyline, along with good sleep hygiene measures, are often used to help reestablish a restorative sleep pattern. Muscle relaxants like cyclobenzaprine may also be prescribed to relieve muscle tension and discomfort. Other helpful treatments include serotonin norepinephrine reuptake inhibitors like duloxetine, venlafaxine, and milnacipran. Selective serotonin reuptake inhibitors, such as fluoxetine, paroxetine, or sertraline, and anticonvulsants like gabapentin and pregabalin, which can help calm overactive pain signals. Cognitive behavioral therapy has also shown effectiveness in improving sleep and reducing the mental burden of pain. Individualized exercise programs are important as well. While patients may be hesitant because movement worsens their pain, research shows that gradual exercise improves muscle strength, decreases discomfort, and helps combat the deconditioning that fibromyalgia causes. There is also promising evidence for complementary therapies, such as acupuncture. Nursing care for patients with fibromyalgia requires sensitivity and support. Many patients have lived with their symptoms for years and may feel that they have not been taken seriously. Nurses play an essential role in validating these concerns, providing encouragement and reinforcing the treatment plan. Listening carefully to the patient's descriptions of pain, fatigue, and daily challenges helps guide individualized teaching and support. Patient support groups can also be a valuable source of shared strategies and encouragement. Now let's finish with a look at miscellaneous disorders that also fall under the umbrella of rheumatic diseases. This category includes conditions that are linked with arthritis but don't fit neatly into the other groups. Some are the direct consequences of trauma, such as internal derangements or loose bodies and joints. Others are linked to systemic diseases. For example, pancreatic disease can cause avascular necrosis, sarcoidosis can involve the lungs and lymph nodes, and palindromic rheumatism is a rare type of recurrent arthritis that can progress to rheumatoid arthritis in some cases. Additional disorders include villonodular synovitis, chronic active hepatitis, and drug-related rheumatic syndromes. These conditions are diverse, but the nursing role remains consistent, managing pain, supporting mobility, and watching closely for the musculoskeletal complications that often get overshadowed by the systemic illness. Interventions must always be tailored to the specific disorder and the organs involved, but the core nursing principles of patient education, symptom management, and support remain central.